The Medical City is the largest hospital network in the country, JCI accredited since 2016, a pioneer program for adult critical care medicine in the country. The first and only subspecialty training that is open to specialists of internal medicine, emergency medicine, surgery, anesthesiology, a 31-bed multidisciplinary intensive care unit, surgical, neurocritical, medical, nutrition, with the capacity for advanced hemodynamic monitoring and resuscitation. Providing 24 hours of service to ensure continuous high-quality patient care wherever the patient is in the hospital.
Critical care, or intensive care, is the medical specialty that takes on the extremes of human disease or injury. We say specialty, but an intensivist uses a generalist approach. An intensivist must be an expert in the treatment of all forms of organ dysfunction, no matter what their original training was. We use the skills and knowledge of all these specialties to defy death and alleviate suffering. Every number and line on a monitor, every value or trend in the lab flow sheet, is used to optimize care for each patient. Critical care is a team endeavor, so we work with highly trained nurses, pharmacists, physical and respiratory therapists, and all kinds of technicians to make sure that we protect the sickest patient's quality of life. Because critical illness has no boundaries, neither does critical care. In the ICU, in the ER, in the OR, wherever and whenever a patient needs it, the team will provide it. It is one of the most challenging disciplines, and it isn't for everyone. But if you are someone that will run towards an emergency rather than away from it, if you are someone who wants to be comfortable with complexity and controlled chaos, or to confidently discuss the state of the science with peers, or difficult prognosis with patients and families, if you would like to learn how to best perform life-saving interventions and yet also know when to withhold them, critical care is the best job in medicine.
Now more than ever, our country needs intensivists. Training in critical care medicine at the Medical City will enable you to learn from our multi-specialty, formally trained intensivist faculty. You will experience hands-on training in our world-class JCI-accredited ICUs.
Progressive, outstanding, evidence-based. Supervised hands-on skills training and simulation education. Post-cardiac arrest care. Post-operative critical care and nutrition, critical care ultrasound, ECLS program. The Critical Care Medicine Fellowship Program has produced 12 graduates now practicing all over the country.
Critical care is a high-stress environment. In the Medical City, we are trained to be tough, hardened physicians that can withstand the intense, heart-shaking, mind-boggling cases that many would back down from. Things you never thought you were capable of doing will come as second nature. But while we steel our minds and resolved, we do not lose our heart. We are made tough for one purpose, and that is not to give up on our patients. When you have a patient who is on the brink of death, you and your team was able to bring them back is the most rewarding aspect of this career.
The best of its kind. The specialty itself is a game changer, and that decision to have that training in TMC is worth the investment.
My training helps me to become a better internist. It helps me to discover my limitations and my potentials. It improves my self-confidence in handling critically ill patients. With the help of my consultants, I was sent back to Cagayan de Oro City after 2 years in training, equipped with knowledge and experience to serve the people in Northern Mindanao.
What is unique in training under acute and critical care is that how each team members value in the multidisciplinary approach in managing our critically ill patients, which greatly improve the outcomes of our patients at the medical center.
For me, is the kind of confidence we have developed out of managing this volume and case mix of patients, especially procedures. It's something that I bring with me at this early stage in my career as an intensivist. Wherever I go, I know that there is something new that I can bring to the healthcare team, whether it be perspective or just a different way of approaching a very sick patient, and always giving them a good fighting chance.
Ensuring that we're with you during your toughest of times, working with a multidisciplinary team. We hope to give all the very sick a good fighting chance.
On my second month as a fellow, I had a 56-year-old male who seized for an hour and a half. At that point, I was thinking his brain will be fried. We secured the airway, anti-epileptic drugs started, bedside echo, imaging and diagnostics done. Together with other specialties, the team covered all grounds. And with the critical care management he received, he is now awake, able to follow simple commands, and slowly getting better. With the right team, great outcomes can be achieved.
At times where no other practice dare go, the intensivists are here for you. Mitigating the risks at the front lines and serving as the last line of defense for the patients.
In the 4 minutes that my heart stopped beating, it's just like that was all, my whole life was taken away from me. And then coming back, it's just like, wow, it's huge, it's bigger than the lottery or whatever. It totally flips your point of view of life. And I guess I gotta thank everyone. Like I said, it's like I don't have enough thanks to give to every single person in this whole army of people supporting. So
No matter the situation we might face, despite uncertainties, we move forward. The Medical City Critical Care Medicine, 11 years of leading in service, training, future intensivist, and innovation. We excel because we have the right team here at the Medical City. No one fights like Acute. The Medical City.